This is an illness that takes away a woman's ability to access joy right at the time she needs it most. This is a quote by Dr. Catherine Weisner in regards to postpartum depression. Postpartum depression is a very serious illness affecting many women worldwide after the delivery of a newborn. It is an often overlooked and underdiagnosed illness. Today I'm going to bring you awareness today of this awful disease. According to the Cleveland Clinic, 50 to 75% of women experience what is called the baby blues. This is a feeling of maybe sadness, a little bit of just exhaustion from caring from a newborn. All their attention is directed towards that, and maybe have a little loss of appetite, just kind of feeling down, but nothing too serious. However, 15% go on to develop what's called postpartum depression. Postpartum depression is a very serious illness, and it really needs to be clinically diagnosed and treated appropriately by a provider. Like I said earlier, this illness is often overlooked and underdiagnosed. I'm going to discuss with you today and educate you about postpartum depression. Postpartum depression, like I said, affects many women worldwide. You don't necessarily have to have a history of depression. However, women that have a history of anxiety and depression are far more susceptible to go on to develop postpartum depression following the delivery of a newborn. There's many things that can be done to kind of gauge and access a woman's how they're feeling, but most importantly, women need to also speak up and not be afraid to talk about their feelings. This is partly why it becomes overlooked and underdiagnosed. Women feel maybe ashamed, or they don't feel comfortable discussing these feelings, which I'm going to discuss in just a little bit, to their provider. Postpartum depression, like I said, can affect many different people. You don't have to have a history of depression or anxiety. It can actually just come on and come out of nowhere, and that's why it just affects a wide range of women. And so I'm here today to discuss with you some of the side effects and symptoms of postpartum depression. Postpartum depression is a feeling of extreme sadness, loneliness, lack of appetite, just feeling really depressed, feeling like the woman can't take care of herself or even her newborn after the delivery. This is supposed to be a joyous time, and these feelings are not okay and need to be voiced, and a provider needs to clinically diagnose and assess the situation. There are many different treatments for postpartum depression. If a woman does have a history of anxiety or depression, hopefully their provider or clinic will follow them a little more closely. There's something called an EPDS, which is kind of a gauge. It's a questionnaire regarding the woman's mood during the prenatal time and also following the postpartum delivery time. This is something that can be done through the prenatal period, and a provider can kind of assess the situation and see how a woman's mood has changed, if it's gotten worse or better. And that can be a great indicator of, how they may fare after the delivery of a newborn. It's a very joyous time, but also it can be very exhausting and stressful. The baby blues, which according to the Cleveland Clinic do affect 50 to 75% of women, are very normal feelings, and that's just pure exhaustion from caring from a newborn. It's very important for one's partner to also be aware of the situation and know the symptoms and signs of postpartum depression, so the woman can feel better and feel like she can actually go and discuss this horrible illness with her provider and the feelings that she's having. So some treatments for postpartum depression include medication and therapy. Studies have shown that the combination of the two actually work wonderful together. There's different pharmaceutical options to take, antidepressants, anti-anxiety medications, but it's actually been shown to work extremely well coupled with therapy. So just talking to someone, having someone, a therapist, or maybe there's a provider in the practice that can, um, you know, discuss these feelings that a woman's having, really helps a woman get through these difficult times. Coupling that with pharmaceutical therapy has been shown to have the best result. Some people may go on to have a wonderful outcome with therapy only, which is great, or maybe just medication only. It's really up to the individual woman and the provider's discretion. So I just wanted to bring today the awareness of this illness and hope that women just don't feel so ashamed and feel like they can step up and talk to their provider and not feel ashamed to have these feelings, because they're very normal feelings to have.